afternoon, Prof, and welcome to our Facebook Live. And Prof, we all know that you have the reputation of being the father of IVF in Asia. And in 1983, the first IVF baby in Asia was first created. And can you introduce more about yourself to our viewers?
Yes, thank you. Welcome to our event, and I hope you are all having safe distancing. Maybe you are watching from home. Anyway, thank you for listening. So as to my background, I have been a gynecologist and I specialize in reproductive medicine since the early 1980s. Actually, I had my specialist degree in 1980, and in 1981 I started my training in IVF, and I came back to Singapore and I started the first IVF laboratory in the old KK hospital. I was then in the University Department of Obstetrics and Gynecology that was based in the old KK hospital. I remembered my first laboratory was actually a converted male toilet in the operating theatre, but that was historic, and that was how we began. And by the fourth case, or the second embryo transfer, we managed to succeed. And I believe we managed to succeed mainly because I paid very crucial attention to all the minor details, and it was very, very important. So anyway, those were the early days. Since that day when we first started, we developed many new approaches. For instance, I pioneered the technique of microinjection, and that was a major breakthrough because male infertility was really a big problem. And I developed the techniques when I was on my sabbatical in the Vista Institute in Philadelphia, University of Penn, and they managed to I was looking at the studies of male, the differences in the ability of the male genome in a fixed stage in the female genome. So I introduced all the way from mature sperm to the very immature sperm in the spermatocytes. Of course, I was working on the mouse model, and when I came back to Singapore after my sabbatical, I started on the human, and that was how I developed the technique of SUSI, or subzonal sperm injection, and we achieved the world's first pregnancy from SUSI then. So that was all history. We helped to pioneer many new approaches. We developed it from the other people who pioneered the various techniques, including freezing, and then we were the first in Asia in many of these areas. So I hope that gives you an idea of the background, and I have been in this field since the early 1980s, and that means from 80 all the way down to 2020, there's about 50 years of experience.
I see. So, Prof, with your many years of researchers and experience, right? So, can you share with us that who should see a fertility specialist?
Okay, the development of infertility treatment in Singapore has been rather slow, but still the primary doctor or the primary first point contact for the patient should still be their GP. They should approach their GP for advice, and if the GP thinks that it is important for them to see a specialist, then he or she will refer. But if there is a underlying problem that needs the urgent treatment with IVF, for instance, then it is better to see the fertility specialist straight away. For instance, if the patient knows that her egg reserves are very low, maybe she has got very irregular menses since young, and she has had some investigations, and the doctor has told her before that her egg reserves are low, then of course it would be better to go straight to a fertility specialist. On the other hand, if the male or the guy happens to have very low sperm count based on some investigations done before, then it's also important to go straight to the fertility specialist.
I see. So what kind of tests do couples need to do to find out more about their fertile health, and what should these tests be done?
Of course, the tests are divided to both male and female. Let me talk about the male first, because it's very easy. Most males, of course, would have done what we call a basic semen analysis, but that is quite basic, and that is really like a screening test where one can identify whether or not there is a possible male problem. But we also know that the sperm may be okay on the semen analysis, but still have a problem. For instance, the DNA fragmentation may be highly abnormal. Maybe the male has been smoking a lot, so we know smoking really results in fragmentation of the DNA of the sperm, and the DNA fragmentation would then result in abnormal embryos and abnormal babies. So the DNA fragmentation test is a specialized test done only by certain laboratories. We are one of the few laboratories in Singapore that do this test. The other example, for instance, may be the poor ability of the sperm to attach onto the egg. This is the hyaluron binding assay that we use to check for the ability of the sperm to attach to the eggs. Okay, so that's for the male. For the female, there are many other tests. The most basic test that we do mainly for the female would be really tests to look at the control of ovulation. So these are hormonal tests. The woman can actually have an idea of whether she is ovulating herself by doing what we call the basal body temperature chart at home, or she can even do the urine LH test kit at home. But if she needs to do these investigations in the clinics, we normally do hormonal tests. So these hormonal tests are usually done between day 3 to day 5 of the menstrual cycle, except for serum progesterone, which has to be done in what we call the mid-luteal phase. So that should be around day 21 if the woman has a regular cycle of around 28 days. So this would be the hormonal test. But there are also other tests that we do sometimes. Ultrasound, basic ultrasound also be useful because there may be gynecological problems like fibroids, or the ovaries may look quite polycystic. So that can be actually seen quite clearly from the ultrasound. Sometimes we also check for tubal patency, that means whether the fallopian tubes are blocked. So this can be done with HSG. It's a fluoroscopy procedure done in the X-ray department. Though nowadays there are some centers that actually do this test using foam or special solutions rather than radio opaque dyes, so you don't need to do it under irradiation. So that may be better because exposure to radiation is not good, especially for the eggs.
I see.
And sometimes when the ultrasound show, for instance, cysts like endometriotic cysts, as part of investigations and even treatment, laparoscopy is the operation. Keyhole surgery can be done. So this is usually done by the fertility specialist.
Okay. So why are these screening tests important for couples, and how could these tests better understanding the couple's fertile health?
Okay, so basically, all the tests will then give the doctor an idea of what is the problem, because the treatment will have to be tailored to the kind of problem the patient has. So, in principle, we should always start with the simpler treatment, because some patients may get pregnant with simple procedures like monitoring of ovulation, coital timing. The next step may be intrauterine insemination, where you wash the sperm so that you get better quality sperm, and then you put the sperm directly into the uterine cavity. So that helps also in terms of the timing and the fact that it is closer to the egg. However, IUI pregnancy rates are not high. Generally, quoted figures is only about 10%. But it is still about 2 times that of the patient trying to get pregnant on her own. This relates to the question of what's the chance of the woman or the couple being able to get pregnant while trying on their own. This is called the fecundity rate, and the normal fecundity rate is about 25%. But from what I told you, if IUI pregnancy is 10% and double of the patient trying on their own is only 5%. So how come fecundity rate is 25%? This is because the normal fecundity rate is taken in the population in general, including fertile patients. So when you look at a subgroup of patients who are infertile, the fecundity rate or the ability to get pregnant is much lower. So that's why it works out to only about 5%. So coming back to treatment, after IUI, you can then, if that fails, normally we try up to 3 cycles. You can have simple IUI. For IUI, the success rate is also tied to the number of follicles. So that's why we increase the number of follicles by giving medication. You can take letrozole, you can take clomiphene. Sometimes we combine it together with FSH injections. So there is a type of IUI called superovulation IUI, where you just give hormone injections, and then increases the number of eggs and number of follicles. So the pregnancy rates will be higher when you have more follicles. But unfortunately, that also increases the chance of multiple pregnancy.
I see.
So the problem with multiple pregnancy, especially with superovulation IUI, is that you cannot control the number of eggs that are ovulated. So the high order multiple pregnancies like quintuplets, sextuplets, those are usually from IUI because you cannot control the number of embryos that are created. Unlike IVF, even though you get a lot of eggs, you get a lot of embryos, you only put back one or two. So the number of multiple pregnancies are much lower.
I see. So, are fertility treatments age sensitive?
Yes, definitely age dependent. The female particularly, because a woman is born with a fixed number of eggs, and when a woman is 40 years old, the eggs are 40 years old plus a few months because the eggs are created when she was inside the mother's womb.
I see.
And then they get arrested. They have a long period of arrest until that particular month in which the egg is destined to come out. Yeah. So when she starts to have puberty, then the first set of eggs will start to mature. Then maybe about between 12 to 14 years old. So that's why the chance of pregnancy when a younger woman is higher because these eggs are younger. By the time she reaches 40 years old, the eggs will be 40 years old plus a few months.
Yes.
So these eggs are more prone to what we call meiotic division errors, so higher chance of chromosomal abnormalities, and also lower, because these are abnormal embryos that are created. These embryos have a lower chance of getting implanted, so the chance of pregnancy is lower.
Okay.
And also conversely the increase in chromosomal abnormality rates like Down syndrome.
Okay. So, what are the different type of fertility treatment that you provide?
That's available. Yes.
Yeah.
The Sincere IVF Center actually provides the entire range of infertility treatment for male infertility as well for female infertility. We have right from psychosomatic, like patients with sexual dysfunction problems. We have our sex therapist who is ex-World Authority, Professor Ganesan. He will be able to counsel and able to treat the patients. To urologists, we have urologists who are able to see patients with male problems. Then we have the whole range of treatment from simple treatment all the way to IVF ICSI. And our IVF laboratory is quite advanced because we have the full range of equipment to give the best monitoring systems for current embryology techniques.
I see. So, what are the most common infertility cases that you have seen?
Okay, we have seen all kinds of infertility problems, but ovulation problems as well as male infertility problems are the most common types that we see. This can be managed by simpler methods all the way down to IVF ICSI.
Okay. And are there any medication or supplements that could able to aid couples during their journey seeking for infertility treatment?
Okay, so that comes to more like lifestyle and nutrition. So these are also important because it's not only the treatment. So it is important for the couple to ensure that they are in the optimal state for fertility. So we do know that stress is quite common in our population here in Singapore, maybe because of the nature of the work, because of the both husband and wives are working, so timing can be a problem. Fortunately, in Singapore, nutritional problems are not so common because a lot of the patients generally the standard of living is quite good, so they are able to get a good diet, good proteins, unless they choose to have a diet that is a bit unusual. So there are some patients who do not like to take proteins or do not like to take particular types of food, so maybe that can affect their nutritional status. So for us, I think we always recommend for all couples who come to our clinic to take some basic supplements, but we compound ourselves. So we have developed two kinds, one kind for the male, one kind for the females. So this is OVU Health. This is the compound that we develop ourselves, and OVU Health is for the female. It's quite a complex formula, as you can see over here. There's a lot of contents, and they are not in the capsule form or tablet form. They are called microgranules, so we call them fish food because they like fish food. Yeah. Okay. Likewise for the male, we have us for the female. So Vegan Health is for the male, and slightly different types of contents, but also in forms of microgranules. So I think it is useful because dietary micronutrients are quite important. So I think most of us should have some, but sometimes not enough. And one of the supplements that usually not enough really is vitamin D. D for Denmark, because vitamin D is actually made by our body through exposure to sun. Unfortunately, in Singapore, we all don't go out to the sun enough. If we do go out to the sun, we'll have umbrella or we'll have the hat, so our skin is not so exposed to direct sunlight, so vitamin D production is not very good. So we are quite deficient in vitamin D. So vitamin D is important in both sperm production, fertilization, and implantation. So this is important. This is an example, but there are other kinds of small micronutrients that may be useful.
Okay, Prof, so far, what is your advice to couples who are actually facing infertility issue? Do you have any advice before we end the show? Maybe you'd like to give some advice.
Yes, I think there are two things that I would like to emphasize. Number one is don't delay too long, because we have had patients and couples who think that okay, maybe they don't really need to try early, so they delay, and by the time they start to try and then they realize that they can't get pregnant, and then do the investigation and found that if they had done the investigations earlier, they probably could have picked it up earlier. So one is to try early. And number two is for patients who are further down the journey, the important thing is don't give up. The hope must always be there. And sometimes the journey can be difficult, but hopefully you can reach the end successfully. Yeah, so don't give up so easily. Even if you cannot get a baby of your own, there are alternatives available. Donor eggs, donor sperm, or even adoption for you to fulfill your desire to have a family. I hope that gives you a good idea of infertility treatment, and if you do need to see your doctor, there are many fertility doctors in Singapore. So please seek their advice if you need further help and assistance. Thank you very much for listening, and maybe I wish you, I definitely wish you best of luck in your journey.
Okay, thank you, Prof, for sharing with us so much of your experience, and also with your encouragement words to all those audience who are actually facing some infertility problems, and they are still maybe thinking whether they should come for to seek treatment from the specialist or not. So thank you so much, and we wish you all the best, Prof.
Thank you.
Okay, so for those viewers who have any question that you would like to ask, so we always welcome you to send us all comments, and so that we can actually get our prof to answer you. Thank you.
Thank you very much for listening. Bye.